Hi mamas, are you vomiting nonstop in your pregnancy? Is your vomiting so frequent you can't even drink water or stay hydrated on your own? Well, in this video, I'm going to share with you what exactly hyperemesis gravidarium is and some ways to cope with this condition during your pregnancy. My name is Sweeta, I'm a registered nurse in the LA area, here to share my mommyhood experience with you all. If you like this video and want to see similar content, please like, subscribe to my channel, and keep watching for more. Alright, let's just jump into it. For those of you who don't know what hyperemesis gravidarium is, it is basically the morning sickness that just never goes away, and some people can get a little better at coping, but most pregnant women are left feeling miserable and wishing they could do anything else besides vomit all day. Well, today I'm going to tell you about my experience with hyperemesis gravidarium as well as some tips that helped me out in the process. So basically, hyperemesis gravidarium is the uncommon disorder in which extreme persistent nausea and vomiting occur during your pregnancy. This condition might lead to dehydration. Some causes are by rapidly rising serum levels of hormones such as your HCG and your estrogen. This can cause your body to not respond properly and just be nauseous and vomiting all the time to an extreme level. This extreme kind of nausea and vomiting might indicate a multiple pregnancy, like if you're carrying more than one baby. Symptoms of hyperemesis gravidarium are pretty easy to catch, I would say. So if you're vomiting more than 3 to 4 times per day, so much so that you are losing more than 10 pounds, so much so that you feel dizzy and lightheaded and even become dehydrated. And if you are that dehydrated, you might need to go to the hospital to get an IV bag of normal saline or lactated ringers, or basically like an IV bag of hydration. And some risk factors for hyperemesis gravidarium include being overweight, having a multiple pregnancy, being a first-time mother because your hormones are just increasing and your body doesn't know what to do with it, or the presence of a trophoblastic disease, which again involves the abnormal growth of cells inside the uterus and is not a true pregnancy. So how can you get this condition diagnosed? Well, a healthcare provider will ask you about your symptoms, your history, and other lab tests to help to maintain the diagnosis. And the type of treatment that is required depends on how ill you are. So some possible treatments are preventative measures like a pressure point wristband, similar to those used for motion sickness, or vitamin B6 and ginger. Maybe some small frequent meals because it's important for you to maintain your fluid and food intake during a pregnancy. And of course, the most invasive measure of treatment is IV fluids that you will need to go to the hospital for or to a clinic and get IV fluids like lactated ringers, some dextrose, some normal saline, so that you can get hydrated, mama, because you are carrying a baby in there. Sometimes in the worst condition, you will get nutrition through your IV called total parenteral nutrition. I've seen this a lot in the hospital with very sick elderly patients. I've never come across a pregnant woman with it because I don't work on that kind of unit. I work in a medical surgical floor. So in this case, if a pregnant woman does need parenteral nutrition, you know that things are not good. You know that mama's not getting nutrition, and so it's so important for mama to get hydrated for baby and for herself, for have that proper nutrition, the vitamins, the minerals. So these probably are the best treatment options for the very extreme cases. Is there any way to truly prevent hyperemesis gravidarium? Well, there are no certain ways to completely prevent this condition, but the following things that I'm about to tell you might help your morning sickness become better. Let's see. So again, mama, try eating small, frequent meals, eat some bland foods, wait until your nausea has improved before taking any kind of supplements, use a pressure point wristband, vitamin B6 and ginger as recommended by your healthcare provider, and drink water every 2 to 3 hours. And now you're wondering, is this condition fatal? No, it does not threaten the life of either you or your baby. You will get through this condition, mama. I personally went through it during my first trimester while I was vomiting non-stop. I was so dehydrated. I ended up going to the ER to get an IV bag of hydration. That helped me tremendously. I remember just peeing so much that day because I hadn't peed for such a long time. You will get through this, mama. You will probably not have it with another pregnancy if you've already had it with your first pregnancy. It's just your body's way to adjusting to all the HCG and estrogen levels and progesterone levels going sky high during pregnancy. So again, mama, follow my tip for easier ways to cope with this condition. If you have any ways that you've coped with it, please comment. I would love to hear what you have to say and how you dealt with this condition. And if you liked today's video and want to see similar content, please hit like, subscribe to my channel, and turn your post notifications on. Thanks guys, I'll see you in the next one.